So today, the cabinet decided to extend the state of emergency for another month. So as a doctor who gives priority to saving lives and to health, I'm sure you would agree with the decision, right? But how would you address the concerns by many people who don't see this thing the way that the government does, that they don't believe that the extension of the state of emergency is necessary?
That's really depending on the understanding of the situation that everybody is now seeking to do so. I mean, everybody is now trying to understand the situation themselves the best they can and try to evaluate what the country should do by themselves. But with the situation that we all know, the number that we report each day that has very low number of patients that contracted the disease within the countries, or we could say that very limited local transmission. I think it's lead everybody to think that we are doing okay and we may not have that much of a patients contracted COVID in the countries. That is a right interpretation of the situation. We have low numbers, low risk of transmission at the moment, but the situation can come back very rapidly when we relax our prevention measures. So at every step of the way, although the situation is look very good, but it is not. It doesn't mean that we can relax and going back to the normals. And I think that the countries now also understand that people still wearing masks, although smaller numbers doing so, but majorities of population is still wearing masks when they go outside of their household. That is a good sign, and I wish that we could keep those practices, a lot of those practices going on into the next month. So, and I would say that their interpretation of the situation is quite correct. But just to remind everyone that when we see other countries doing their business and some of the countries, even they have a very small number of the cases, there's one phrase that I would like to say: there is no country open completely. It means that although they have very low numbers of cases, they're still very cautious about the situation, just like what we do today in Thailand.
So Dr. Tanarak, the World Health Organization today also came out with a warning of a possible second wave of the pandemic in countries where the situation might have seemed to have improved. So we should take the warning from the World Health Organization seriously, right?
That's right. And some of the countries that have a very good control measure for the first wave, when it's come second wave, it is not as easy as the first one. I think one of the major reasons for that was when the country was hit with the first wave, everyone kind of don't know what to do. So everybody's trying to prevent themselves very well. But with the success of those first wave, some of the people may think, well, we can do it again. Those kind of thinkings. So the second times around is not as easy as the first one. As we can see, the situation in Singapore is still underway, although they try their best. And we know that Singapore is a country with a very high capacity, but up until today, they still suffer their second wave.
So what would be your advice, or what is your take right now? Because the Ministry of Tourism and Sport have proposed that the government should allow inter-provincial travel probably very soon in the next 2 weeks. Do you have any extra precaution that you like to communicate with people?
I would say that out out of the measures that we are doing at the moment, some can be relaxed, of course. Travel between provinces, I think that is also should be relaxed. But some of the measures that we are doing so good in the past, I think we should continue to do so, and we should try the best, trying to keep those practices as best as possible. So always public health measures of investigation, of identify contact and tracing the contact for 14 days. We have done quite a good job, and we are going to do a good job, continue to do so. On the other hand, for the social measures that we are doing, some of them are not ordered by the government, or I would say we have done it voluntarily. For example, work from home, or wearing masks, or doing those kind of things. I think those things should stay. Some other things that really relax, and some of the rules that we set up to make every places have to have a lower risk of transmission. I think everybody should try to stick with that. If we can do that, I think we can relax more business or more activities for people to go around with the low risk still. So I hope we can achieve that. I'm also looking forward to see things open up even more. But as I mentioned earlier, for the high risk activities or high risk venue or establishment, I believe that we should be very cautious about that. As I mentioned earlier, no countries open completely, open every business. That is not the case.
So those high risk groups still have to be maintained, still have to be closed, like the boxing stadiums or the sports activity would be coming as the last on the list to be reopened.
Yes, and I mean other activities that based on similar rules. For example, the gathering of the large number of people, that should be also prohibited as well. So the places like, for example, nightclub, that would need some measures to make it safer than it used to be. So this is, I believe that when we are looking forward, everybody should kind of help each other by coming up and not just not just talk about open or reopen, but I think what we should think instead was that how to reopen it safely. If we can come up with those kind of plan, I think it should be we can move the agenda forward easier than just mention that we should open it.
Dr. Tanarak, we have only 3 reported infection cases today, right? And they are all
right.
Thai returnees under state quarantine. Do you have any observation on this?
As we all know, at the moment, most of the cases at the moment are people returning from other countries, and we still have that coming. For the whole month, we are having on average 200 to 400 returnees a day, and some of those come back with infection. So we have to be very cautious about international travel, especially people coming back from other countries. That is why we still work very hard on quarantine the returnees and tracing their symptoms for the whole 14 days, so that we can prevent the spread within the countries. So for the international travel, as we looking at the moment, we have to be very cautious as well, because certainly majorities of the cases we have today is returnees from abroad.
And Dr. Tanarak, there have been more talks about the so-called alternative quarantine facilities, right? For example, with hospitals, private hospitals and hotels accommodating returnees from overseas. Do you have any concerns about this?
What do you mean by that?
I mean, Dr. Tawisin, for example, has been talking about this so-called alternative state quarantine, right? By having people who come to Thailand from overseas confined to hospitals, private hospitals or hotels that can work together to quarantine these returnees. Do you have any particular concerns about this kind of facilities?
I think it is a good idea. I think because it's help business running as well. And if the hotel can follow and local government, I mean, local staff can work closely with the hotel that they choose for the returnees. I think that would help the business within the provinces as well. The rules for the quarantine is not that hard to follow. All we want to do is that all the returnees stay in their rooms, that convenient enough, and they are not coming out of their rooms. All of the food served to their rooms, and if they can, what we would do is that we would like to check their health for the whole 14 days. So if we can do that, you can see that if this help the business of the provinces, that would be helpful in this situation. It is not just the hotel, but it's all of the other employees and also about the food preparation. So not just only 1 or 2 person will benefit from this. I think the local will get better by doing that as well.
Any particular concern regarding the reopening of the school on the 1st of July, Dr. Tanarak? Yeah, like today, President Duterte of the Philippines said he won't reopen the school until they've got vaccine.
Oh. I would say that the school, there are so many kind of risks and so many kind of school in Thailand. Reopen the school, if I would say, is possible under very watchful eyes. First of all, for the school, small school, very small school, less than 100 students with a lot of rooms and the student can come to school without going to to be crowded in the rooms. Those kind of school in the province that have never had a COVID case before, those should be able to reopen. But with all of the measures that will try to prevent the student and also the teacher to get the disease with a very good screening measures, preventing the kids who has signs and symptoms of acute respiratory symptoms to come to school. Those kind of measures also needed with a very low risk school. I think what we are so concerned about is not those kind of school where there are small number of students and on the countryside or very far from the dense population. But what we are so concerned about is large school with a lot of students and so many students in one classroom or very large class size in the cities, because there are so many things that could happen when the school reopen. One thing that will be very sure is that the public transportation will be jam-packed back in the same ways that we used to have. The train, the bus, everything will be jam-packed with people. So we have to think about the situation outside the school as well, not just within the school. Within the school, the same rules should apply. When we apply the rules to the restaurant, to the department stores, for example, we don't want to have people coming close to each other within 1.5 meters, 1.5 meters, or 2 meters in vicinities, I think those rules should apply to school as well. So what does it mean? It means that students should sit about 1 or 2 meters away from each other. In order to do that, I think the school have to adjust quite a lot. And the safer ways for the school, for the large school and in the city school is that they should what I call apply the hybrid kind of learning. Some of this the school can be reopened, but not the same way as they used to do. They have some students have to study both at school and both from home. I mean that probably student can come to school not 5 days, but probably around 1 to 3 days, depending on the capacity of the school to have a long distance learning or online learning for the student. When I say long distance learning, it doesn't have to be television or it doesn't have to be an online platform. There are so many ways that we can teach our children away from the school at the moment. There are so many ways to do so. So the school, I believe that would be open on July 1st, but not in the same ways we used to open the school. The students, I believe for the large school within the cities, especially in Bangkok, may have to open partially. Students can still, just like our adult, that we still encourage government staff and also private employees to work from home. Some partially students can also learn from home and come to school a few days a week. So the school will not be so crowded, and school must have also the very stringent prevention measure at school as well.